Good morning, everybody. It's Monday, 10:30. You know what that means. I'm here with a presentation today on a topic that is very important. And I don't know if you know this, but May is Melanoma Awareness Month. So I've given a few presentations already on this topic, and it's something that really needs to be on the top of the mind awareness of us skincare professionals every day. We see clients in our office, or you may be a massage therapist, you may be even a manicurist, and you really need to be looking at your clients. And hey, for those of you who maybe are popping on right now and don't know me, I'm Stephanie Halvick. I'm a registered nurse, owner of RN Faces, and I'm in my office today. And this poster right behind me, it's backwards because of the computer, but I'm giving away 3 of these during this presentation. And a few housekeeping things. I'm going live here on Facebook. This is my business page, RN Faces, and this is where the giveaway happens. But I'm also streaming right now on LinkedIn, YouTube, and in my group, Thermolysis Skincare for Estheticians. But if you want to win one of these posters, you have to be on my business page, RN Faces, because that's where the giveaway will take place. And also, let me know if you're here. If you're here and you can hear me, everything is great. Give me a thumbs up, give me a heart, let me know. And also for the skincare professionals out there, the massage therapists, anyone who happens to be working with skin, if you want my slideshow today, then go ahead and in the comments, I would like to see the letter M, slides. I think maybe, let's see if I can put that in there for you as a comment. Oh, good morning. Good morning. Okay, great. Oh, Eric and Deborah, Jen, awesome. Yeah, I know, Mallory, I hope that you are watching, and I hope everybody's watching. So in the comments, go ahead and put M slides, and you will get these slides. So you know I have a lot of different slideshows, but how about just M space slides, and you'll get those slideshows delivered to your inbox. Great. Yes. Okay. Awesome. You're doing that. And then I will pick 3 people during the process, and you'll each get a poster delivered to you. So let's go ahead and talk about this very important topic, because it is something that, since this week, since I've posted that I was going to do this, I've had quite a few people message me and say, Steph, I'm so glad you're doing this, because I've had melanoma, and even I had a nurse just last night message me. She says, even though I'm a nurse, I didn't know. And she's fine. Everything's good. But she did have to have a pretty intense surgery with clear borders. So that's kind of what we're going for. We want to be able to detect this melanoma. And again, for those of you that might think, oh, they're diagnosing, we're doing no such thing. But we are trying to get our clients to the dermatologist as soon as possible to make sure that they live, and to make sure that they don't have to undergo such intensive surgeries. So we can't stop melanoma, but we sure can get them to the physicians quicker. And good morning from Holden Beach. Hey, Michelle. That's so great, Michelle. You were up in Cape Charles just a couple weeks ago. That was pretty cool. I hope you had a good time. So I've partnered with the American Cancer Society and the Skin Cancer Foundation, and that's why they allow me to print this poster, and they would allow you to. They want to get the word out. So if you get the slideshow, you're going to get a picture of this in the slideshow. You can go ahead and upload that to Vistaprint, and they'll print you one. So it's just that easy. So today, what I really, the the bullet points are learn to decipher, not diagnose the melanoma in your treatment room, or maybe at your manicurist table, or maybe on your massage table, right? Or some of my clients I see are watching. Maybe you need to check out your spouse's back for them because they can't actually see it. So this is for you too. And I'm going to refresh the ABCs for those of you that have had training and just need a little reminder. Also, I'm going to show you the role of dermoscopy or DermLite in the treatment room as well. But you don't need to have a DermLite in order to do this. And this is important that when detected early, the 5-year survival rate for melanoma is 99%. So we want our clients to be included in that. So we want to make that early detection so that they can get on and get to their physician. So a lot of you maybe have this in your office already. So if you don't, make sure that you do get some ABC posters in your office because it keeps everything on the top of the mind awareness. Your clients will maybe say to you, oh, hey, would you mind checking something out for me? And of course, we always want to check whatever they have. And probably a good standard answer could be something like, oh, well, if it gets any redder or itchier or bigger, make sure that you see your dermatologist. I say that probably 10 times a week in my office. But these are the ABCs. Okay, asymmetry. Most things that are very symmetrical are not malignant, but that doesn't always mean that everything that's not symmetrical is malignant. The borders of like a mole, they should be very smooth, where if you look at the malignant, it's not smooth at all. It's got so many invaginations and different angles. Color is important. Some melanomas will be bicolored, tricolored. They have different aspects in them. But one color typically is something that we don't look at as far as melanoma. Diameter, if something is getting larger, that's why it's always great. If you're a spouse out there, take a picture of your spouse's back because you can see if something has gotten bigger, or if you have to convince your partner that something has gotten bigger. With a picture, you have a baseline. So if you're doing this at home, it's a good baseline. We take pictures before and afters of our clients, so I always have those stashed away in their file. And also if it's evolving, if it's starting to really get different, get itchier, get redder, all of those things are things that we need to look at. So posters like this are really great reminders of what could be just benign and what could possibly be malignant. So this is the poster that you see right back there. And I feel like it is time for a poster giveaway. Who wants one of these posters? Oh, and guys, one more thing. In the comments, make sure it's all one word. slides, all one word. That way you will get the slideshow. I kind of made a boo-boo there. So if you could go ahead and correct that, and that will give you even one more name that I might call for this poster. So I'm going to go ahead and I'm going to scroll, and Eric Rico. Cool, Eric. So Eric, what I need for you to do to get one of these posters is private message me on Facebook with your name and address, and I will make sure that my trusty assistant, Jackie, will get one off to you pronto, and you'll be able to use that in your treatment room so that you can educate and also remind your clients about these types of changes in their skin. So it always opens up a good conversation, and you might be that hero one day. Hey, and if there's anybody out here that has been a hero, let me know. Maybe give us a little notification. I was a hero and got somebody to the doctor for melanoma. In my years in my office, I have yet to detect a melanoma that went to the dermatologist. Now, I've sent the derm many clients for actinic keratosis, all kinds of basal cell carcinoma, but not melanoma. So I haven't been that hero, but I'll bet there are a lot of heroes out there right now. Hey, Chris and Jenny. Oh, cool, Rochelle. Great, great, great. So let me just keep it going here because I do have a lot of slides. So there are lots of ways for you to be that detective. Most of you skincare professionals have a mag light in your room. You can actually even have a magnifying glass for those of you at home if you wanted to be more of a super sleuth and find these melanomas. In my office, we use a DermLite very regularly. I just used one today, and I'll show you those slides because I found something that isn't melanoma, but I'm glad. But again, I have yet to detect one in my office. So let me know out there how many of you are heroes. So you could do it with your mag lamp. You could do it with your naked eye. You can do it with a DermLite. And see, for those of you that have regular magnifying glasses at home, go ahead and use it like this, and you will be able to maybe save a life. So how you can do this with your naked eye. And for those of you might not even know that there is such a thing called the ugly duckling method. And I used this ugly duckling method today. So what the ugly duckling method is, when you look at, say, someone's back, and we have terrific pictures, in our before and after book. And when we do, say, a large back, we can see and pick out anything that may look a little different. So that's what we're going for when something just doesn't quite look like the other things. Like see, like everything on this page pretty much looks alike. The same characteristics, the same type of irregularity. But when you're looking at, say, somebody's back or somebody's hands, even anywhere on the body, you want to pick out what really looks different. So here it is. And, the reason why I love to give these slideshows away is this. Many of you out there are skincare professionals, and it's great to educate your clients on this. So if you can think about going live like this or creating a video or something that you can educate your clients, you may use these slides. And all you'll have to do is simply copy the content and put it on your own slide that you can make in Google Slides. So the ugly duckling is another warning sign of melanoma. This recognition strategy is based on the concept that most normal moles on your body resemble one another, while melanomas stand out quite like an ugly duckling in comparison. So it highlights the importance. These ugly duckling lesions, or outlier lesions that we call them, can be larger, smaller, darker, flat. They don't have to be moles. Also, isolated lesions without any surrounding moles for comparison. When they're completely all by themselves, that would make me pause and think, I want to take a look at this. So here we go, like a self-check here. So everything looked alike on this back except for this red mark on the client's back. So that's considered an ugly duckling, but that doesn't mean it's melanoma. So we don't in any way, shape, or form want to scare our clients, but we do want to educate them. Let me see. I want to show you what I did today. I see clients early in the morning before I before I come here. So I want to show you what I found. Let me find my And I'm going to hide that for a second. I'm going to show this one in the screen, but I'm going to do that. There we go. So I treated a décolleté today for a lot of keratosis. And upon examination, she also had this red area. So look, we have the keratosis, which all looked alike, but here was the ugly duckling. So I wound up taking a picture with my DermLite too, because I wanted to really look at it. And it does have all the characteristics of a keratosis. However, it is irritated. It's not something I would treat because of the irritation. So it could just be from the friction in the cleavage. But regardless, it brought attention to my eye, and I thought I want to give that a better look. So for me, that was a bit of an ugly duckling that I saw just this morning. So that's how we need to start thinking about these irregularities. So we'll go right back here again, and let me go on here. So you can check moles, and the moles may change. The diameter may get bigger. They may get different areas that have different color. But surprisingly enough, most melanomas do not start as a mole. About 30% of moles that change may become melanoma. But most of the time when melanoma is detected, it's flat. So that's another characteristic that I think is important, or something to think about. We're always concerned about moles changing, but we're should also be concerned about flat, tricolor, bicolor types of irregularities. And most of you in my world, we're all looking at irregularities on a daily basis. I don't know if you guys know this, but oh, hey, yeah, good, great, great, great. Remember, it's M Slides, all one word, if you want to get the slides. And I'll be giving away another poster soon. Eric Rico got the first one. I have 2 more to go. But I don't know if you guys know this, but I think a lot of skincare professionals do know that Bob Marley sadly died of melanoma. He was diagnosed way too late. He had melanoma under his big toenail. And he had brushed it off thinking it was a soccer injury, so didn't get it checked out. So that means that melanoma can show up anywhere. So any spot that all of a sudden appears is something that we really want to take a look at, because moles gradually come on at a younger age and are formed generally at a young age. But melanomas just pop up. And they pop up small generally. So he sadly died of melanoma, and he is a constant reminder to us all that this can happen. Look at this. Now, when I say it can happen anywhere, for those of you that are permanent makeup artists, if you're doing an eyeliner, you may be the person that might find melanoma within the eye. So very important to remember this, that it can occur anywhere on the body. And oh, you detected a seborrheic. Okay, great. And Jenny and Mercy. Mercy, I'll get with you later. So just M Slides, all one word, Mercy, so that you get those. And you too, Rebecca. Awesome. Great to see you down in Louisiana. So make sure that you're constantly aware that melanoma can be anywhere. And for those permanent makeup artists out there, or those lash extenders, please be sure to keep an eye out for your clients. Look behind the ear. How many of us look behind our clients' ears? There's always a keratosis lurking, maybe a clogged pore, a blackhead. So we do look behind the ears where our clients might not see it at all. So, they always love it when we find things on the sides of their face that they can't see. Well, can you imagine the joy that they would have if you found something behind their ear or where they can't see it, in order to get them to the dermatologist? And again, just a quick reminder of how we prioritize things, or algorithm of wondering if something is important to get to the client's dermatologist. Things that are asymmetrical, things that have an irregular border, or the color could be tricolor, double colored, or the diameter is getting bigger. And for those of you that take lots of great before and after photos, this is something that you can show your client. I did that this morning, like I just showed you a minute ago, and I have a baseline for this client because I did tell her if it keeps aggravating, please, you should go see your dermatologist. And she hasn't seen a derm in quite a while, so it wouldn't be bad for her to get a good baseline. But I have that picture, so I'm happy to do that for my clients. And oh, it's time for another giveaway. Okie dokie. So let's see, everybody. Oh, great, guys. Hey, thank you, everybody, for watching. So, okay, so start giving me a good thumbs up or a heart, and I'm going to start scrolling here. I'm going to scroll. I'm going to come down. And Deborah Kenyon. Cool, Deborah. Okay, so Deborah, private message me your name and shipping address, and my trusty assistant Jackie will get one of these off to you in the mail, and you will love it for your treatment room and for, I know you're working in a doctor's office too, so they might already have one of these things, but it's also something good that they should have as well. So, okay, hey, great, guys, look at all of you. I appreciate you watching, because we really might get somebody to the dermatologist in time. So let me keep going here. So we're going to look at melanoma as well through the DermLite, because as I scroll through these names, I see that many of you are skincare providers and use the Skin Classic. And if you own a Skin Classic, 99% of you have that DermLite as well. We include it with every Skin Classic and have for the past 7 years, but maybe before that we didn't. So you should be able to even take a deeper dive into looking at the melanoma. So for those of you that have a DermLite, there's many uses for it. Let me just show you a few uses if you have it. Besides looking for melanoma, we want to look at the lesions like I showed you earlier. The ugly duckling, I took a good look at the ugly duckling, and to me, it had no characteristics of malignancy. However, I still would like for her to see her derm. But let me show you. Ooh, go ahead with this. And I'll shrink myself. So there's lots of ways to use your DermLite too. The DermLite can be used for tattoo removal, for to quantify hair growth when you're doing hair restoration. So lots of good reasons, but again, we use it mostly to detect a blood supply. So we're using it in our practices, and that's for tattoo removal. You can actually see the depth of the tattoo, so you'll know how deep to go in with your, if you're using like the limiting or some fluid type of tattoo removal. And also you're going to see capillaries. You can see scars, the white striations and scars. You can decide if something really is hyperpigmentation or not. So again, this slideshow may be helpful for those of you who have a DermLite, because you want to review the different things that you can do with it, and it's very versatile. But so now let's go to see what malignancy looks like under your DermLite. So you can see here, and some of this could be confusing, but I have 2 videos at the end that you'll be privy to from DermLite company, and it's all about detecting all kinds of irregularities under your DermLite, which we don't have time to go into today, but I have those 2 videos for you, very exclusive for you guys. So you will see different things, like look at the very tips of this irregularity. You can see that all those little black squiggles, all those little black dots, that's indicative of malignancy. So, and of course, if we saw this under our DermLite, we could snap a picture of it, and we could even send it to their dermatologist if they had a hard time getting in to be seen. Maybe if they saw something like this, it might get them an appointment a little quicker. Okay, so let's see. So lots of other little things. Some of our spots that we have, you can look with your mag light, you can look with a magnifier. But when you look with a derm light, you will actually see those white little, on the right hand side, you will see those white little bodies inside. Where with normal magnification, you'll see a blue veil, and that is indicative as well. But you're really going to see those bodies of collagen. And that's what those white bodies are. They're collagen. And melanoma needs collagen in order to grow. So you will see those little collagen bodies in a malignancy. So something very interesting and able to see. Now, you could see the difference between a regular mole and a melanoma. The mole is very uniform and has characteristics of a mole. So the melanoma is scattered. It's got those little dark black, brown types of things and has different bodies in there. So these slides are good. You can review these and have them at your fingertips if you put it on your phone. We've all seen the blue nevus in our office, a blue mole. But look, when you look with your DermLite, what you will see in a melanoma, again, are those the collagen bodies. These melanomas can't grow without collagen forming over and over. So you're going to see those collagen bodies form. And let's see here. So somebody has a mole, that's fine. It looks very nice and uniform there. The squiggles are all the same. But here on the right, it's agitated. It looks irritated. There's a few different colors going on. So some of those things can be indicative. Plus those little red bodies in there, some are dots, some are squiggles. That's also indicative. And you're going to learn this in the videos that are coming. So these are just to remind you, these pictures, not to so much complicate it for you, but these, you'll be able to have these as a reference. So the difference that the melanoma looks compared to, say, a very shallow mole that we see in our offices quite often. So this is what I like to think. If I could save someone from something like a huge surgery, this nice lady really looks actually so good for the size of that melanoma that was excised, and then she had a flap done as well. So if it was caught when it was much smaller, it doesn't come up overnight like that. This nice lady could have been spared that larger surgery probably. So I think that's important, and that's a let me get myself out of there. Sorry. So I didn't know, maybe I blocked a lot of those pictures. And if I did, sorry about that. But if you, all one word, slides, you'll get this complete slideshow. You can use this slideshow to educate your clients or to refer to on a regular basis if you like. So look at this nice gentleman. Look at the size of that. Now, that was excised, and look at the incision, right? That's a very large incision, and it's on his back. So he probably didn't see it, didn't notice it. I don't know who actually got a chance to see this and get him to the doctor, but this is something that is quite obvious. And in the picture, it appears that is quite the ugly duckling. I don't see any keratosis sitting there or any other irregularity, but I don't have a full picture of his back, so I can't say for sure, but definitely something that would have been very helpful had that been found quicker. This nice girl, she's young. She actually online is super grateful to be alive. However, she regrets her tanning booth days. Now, I don't know about you, but I used to head into a tanning booth in the 80s, and I thought it was great. It felt so good. But I think they're even outlawed in some states, and if they're not, they should be. So she's alive, but she did look at her beautiful where she was excised, she looks really good. So she had a wonderful plastic surgeon that really helped her, but she is prone to more cancers in her lifetime. So she's got to really keep on top of this, and that's what we want to save our clients from. So now here are one of the two videos. I'm not going to play this video because it will help you if you're into dermoscopy, like with your DermLite. It will help you decide maybe what could be a basal cell or a melanoma or any other type of irregularity. You'll get to see what moles look like under the DermLite. So you'll be able to get a better judge for your clients when you're treating them. So every day I use my DermLite on my clients, or if you don't have one, be sure you use your mag lamp. Be sure that you really look at your clients. And you know what the clients love? When you take time and more effort to really examine their skin. So no matter what you're using, just make sure that you do examine them. So again, this is the step 2 for this same. Now these are about an hour or so you'll enjoy watching this. If you're a skin geek like me, I really enjoyed it, and I have watched them a few times because they can be a little complicated in certain areas, but I get such great nuggets out of these. So you'll be able to watch these. And this is probably the only place that you're going to be able to find them. I was gifted these from DermLite, so they don't mind me sharing this. Oh, it's time for another giveaway. But before I do that, I just want to see if there are any questions. And Thuy, if you want the slides, you have to, next to your name, the word, all one word, M slides, all one word. That way you will automatically get them. If you guys are listening to me on LinkedIn, YouTube, or my group page, Thermolysis Skincare for Estheticians, and you want to win this last poster or get the slides, you will have to hop over to my business page, RN Faces, because then you'll be able to get the slides. You'll be able to, if you do it quick enough, you'll be able to go ahead and get a chance to get one of those posters. So let's see here. And okay, so now I'm going, if there's not any questions, I hope you guys liked this. This is really the end of the presentation. So I want to make sure that any questions might get answered, but it was my pleasure to be here like every Monday. I love to support you guys in your Skin Classic efforts and bring you something that I think is worthwhile for your practice. I think today, hopefully, was worthwhile, and maybe one of you out there will detect a melanoma in your office, send them to the dermatologist, and be that super sleuth, that hero, that melanoma detective. So let's see here. I will go ahead and spin, spin, spin. Let me get to the top. Okay, I want to get to the bottom. And I'm coming to the middle. And it's Joe Goff. Oh, Joe, that's pretty awesome. So, Joe, I know you're watching, so but make sure that you private message me your name and address so my assistant can get them off to you in the mail. And if you are getting the slideshow, you can simply copy this photo into Vistaprint and get your own poster printed. So I hope that's just another nugget for you guys today. And I will see you next week. Thanks, everybody. From RN Faces to you. I'll see you all soon. Thanks. Bye.